Today, we're getting into a condition that really shows how subtle our body's chemistry can be and how important it is to be aware of what's going on inside. We're talking about acromegaly. It's a rare medical condition, quite serious, yes, but actually offers pretty encouraging prospects for treatment.
Okay, let's unpack this bit. Imagine a tiny, like, pea-sized gland at the base of your brain, your master gland, right? And it suddenly starts producing too much of this powerful hormone, a hormone that makes parts of your body grow bigger. Sounds a bit wild, doesn't it?
It really does.
Yeah.
And what's fascinating here, I think, is how a seemingly small issue, in this tiny gland can have such widespread effects across the body. And it really highlights why understanding conditions like this, even the rare ones, is just so crucial for general health awareness and, importantly, for early intervention for you.
Yeah, spotting it early seems key. So that brings us to the core question, what exactly is acromegaly? Right, so at its heart, it's a condition where the pituitary gland, that pea-sized thing you mentioned, right at the base of the brain, it produces way too much growth hormone, GH. And this overproduction, it doesn't just make you taller if you're still growing. It causes various body parts to enlarge and affects lots of bodily functions too.
But it is treatable. That's important.
Oh, absolutely. Successfully treatable. That's a really critical point to emphasize up front.
Good. And when does it typically show up? Is it something that happens in childhood or later?
Well, the sources generally point to it developing most often between the ages of 30 and 50, so mid-adulthood. But the thing is, symptoms can technically appear at any age. It's quite variable.
Okay, and here's where it gets really interesting and probably quite confusing for people experiencing it, the symptoms. You mentioned they develop slowly.
Incredibly slowly. That's one of the hallmarks. So slow, in fact, that people, even their families, might just put the changes down to, well, getting older, normal aging.
Like what sort of changes?
Things like hands and feet gradually swelling, maybe needing a bigger shoe size or rings feeling tight, also just feeling really tired, having trouble sleeping, maybe developing sleep apnea.
Snoring loudly, gasping, that kind of thing.
Exactly. And excessive sweating is common too, or sometimes numbness and weakness in the hands, like carpal tunnel symptoms.
And actual physical growth. You mentioned hands and feet.
Yes, and also other features can change over time. The forehead or jaw might become more prominent, maybe teeth spacing changes. The head, tongue, neck can all increase slightly in size. Skin often gets thicker, maybe oilier. Some people notice their voice gets deeper.
Wow, so it's quite a range of subtle creeping changes.
It is. And then there are other things too, like headaches, joint pain, for women, irregular periods, and for men, potentially erection problems, hormonal impacts.
And what about kids? It happens earlier.
Ah, right. Good point. If this excess growth hormone happens in childhood or adolescence, before the growth plates in the bones have fused shut, it causes what people know as gigantism, so abnormal height growth. Much more dramatic, obviously.
Okay, so what's actually causing the pituitary gland to go into overdrive like this?
The vast majority of the time, it's caused by something called an adenoma.
An adenoma?
Yeah.
That sounds serious.
Well, it sounds like a tumor, and it is a growth, but it's benign. So non-cancerous. It's this benign growth on the pituitary gland itself that just keeps pumping out excess growth hormone, kind of unregulated.
I see. So it's the growth causing the hormone issue. And is it genetic? Does it run in families?
Generally, no. It's usually not an inherited disorder. It's typically something that just develops spontaneously.
That's somewhat reassuring, I suppose. But given how slow the symptoms are, how on earth does it get diagnosed? It must take ages.
It often does. Years, sometimes even a decade or more. Diagnosis can be tricky precisely because the onset is so gradual. A GP, a family doctor, might start suspecting something based on a pattern of symptoms, maybe things we've just discussed. And one interesting thing they might do is ask to see old photographs of you.
Photographs? Why?
To compare, to actually see those slow physical changes over time, the enlarged hands, the changing facial features, things you might not notice day to day. It's a clever diagnostic clue.
That is clever. Like real detective work. Okay, so after the photo comparison, what's next?
Then it gets more specific. Blood tests are absolutely key. They measure the levels of growth hormone and also another hormone called IGF-1, which is related to GH activity.
Right, to see if the levels are too high.
Exactly. And then usually an MRI scan of the brain is done.
To look for the adenoma.
Precisely. The MRI gives a clear picture of the pituitary gland and can show if there's a tumor there, how big it is, and where it's located.
Okay, so diagnosis is possible, even if it takes time. What about treatment then? You said it's treatable.
Yes, thankfully. There are several effective treatment options. Often the first line of treatment is surgery.
to remove the growth.
Correct. If the adenoma is accessible and not too large, a surgeon, often going through the nose, can remove it. That can sometimes be curative.
Wow. And if surgery isn't possible or doesn't get it all?
Then other options come into play. Radiotherapy is one using radiation to target the tumor, shrink it, and reduce the hormone production over time. And there are also medications. These can be injections or sometimes tablets. They work in different ways, but the goal is the same, to lower the growth hormone levels back to normal.
So a range of tools in the toolbox.
Definitely. And treatment is usually very successful at stopping the body from producing too much growth hormone and, crucially, improving the symptoms people experience.
That's great news. But I imagine it's not just, okay, treated, done. Is there follow-up?
Absolutely essential. Regular follow-up appointments with a specialist, usually an endocrinologist, are needed after treatment. This is to monitor hormone levels, check that the pituitary gland is working okay otherwise, and make sure the treatment remains effective long-term. It's ongoing management.
Right, not just a one-off fix. And are there sort of long-term risks or complications to be aware of, even after treatment, from having had acromegaly?
Yes. That's an important aspect. The chronic excess of growth hormone, even if treated, can unfortunately increase the risk of developing certain other health problems down the line. We see a higher risk of things like type 2 diabetes, high blood pressure, hypertension, and various types of heart disease.
Okay, so it has knock-on effects for cardiovascular health.
It does. And also gastrointestinal issues. There's an increased risk of developing bowel polyps.
Polyps. Those can sometimes become cancerous.
They can, yes.
Yeah.
Which means there's also an increased risk of colon cancer associated with acromegaly.
That really underscores the systemic impact, doesn't it?
Yeah.
It's not just about growth.
Not at all. Other potential complications we see include, as mentioned, erectile dysfunction, persistent sleep apnea, and also carpal tunnel syndrome, which can sometimes linger or recur.
So this really drives home the importance of those regular health checks you mentioned.
Absolutely. Especially things like regular blood pressure checks, diabetes screening, and, importantly, colonoscopy screenings to look for those bowel polyps early. You know, if we connect this to the bigger picture for everyone listening, it just highlights how valuable proactive health monitoring is in general. Noticing changes, getting checked out.
Yeah, definitely. So when you pull it all together, understanding something like acromegaly, even though it's rare, it isn't just about, learning facts for a quiz. It's more about appreciating how subtle our bodies can be and how vital it is to pay attention to those slow, gradual changes we might otherwise dismiss.
Precisely.
Because the key takeaway here seems to be that spotting these things early, getting that diagnosis, it makes a huge difference in managing the condition and heading off those potentially serious long-term complications.
Couldn't agree more. And perhaps this raises an interesting question for you listening at home. Given how slowly these symptoms can creep up and how easily they might be mistaken for something else, what's maybe one subtle, persistent change in your own body you might decide to pay a little closer attention to now? It's just a good reminder, I think, that knowledge is really most valuable when we actually understand it and apply it to our own health awareness.
That's a perfect thought to end on. Food for thought indeed.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.